Hospice in LA, Los Angeles, California, especially in the Van Nuys, Glendale, Burbank, and other areas. Now, what's going on is that there's a lot of fraud going on right there concerning the hospice, and they're keeping it on the low. They don't want nobody to know about it. They don't, because over here in LA, California, white people are good and black people are bad. We saw what they did to the people in Minnesota, how they went after them daily. You know what I mean? You thought that Iran was attacking Minnesota. Okay, they sent a fleet of ABC companies down there, from FBI, CIA, DEA, IRA, IRS, you name it, they were down there. Okay, and they went after that fraud. But what happened was that Netanyahu took this advantage. He took this stuff. He said, you know what? Since these Somalians don't want to give us that Somaliland, we're going to go after them, and we're gonna and go after that fraud and boil it up. But what Netanyahu just did was open the floodgates. Now they're going after everyone, but they don't want to go after the Armenians, the Asians, the Persians, the Ashkenazis. No, they don't want to go after them. They only want to go after the Somalians. That's it. But everybody's saying, no, 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 no. You got to go after everybody, because that's discrimination, which it is, where you only want to go after one class of people, but you don't want to go after these people over here because they keep the community white, nice, and everything. So, Governor Gavin Newsom relationship with the 1.5 billion figure and undocumented immigration is most recently tied to a proposed 1.5 billion reduction in state spending on healthcare for undocumented residents rather than a new investment. You see, faced with facial realities in May 2025, Newsom proposed scaling back the Medi-Cal expansion to save the state billions over the coming years. And that was because it was going to come out of their pocket. You see, they only want to do Medicare when it's coming out of the people's pocket. You see, and Medicare Cal expansion costs 3 billion annually. That's yearly. You know, and actual cost surged to an estimate of 9.5 billion for the 2024-2025 physical year. So we see that right there. Now let's watch right now. Oh snap. Time out. I'm sorry. Let's watch. Man,
Hospice company
I might do that
offices.
again.
There's one hospice here that hits all 6 of California's red flags of possible fraud.
Well, there's no hospice there.
Legal office.
Yeah.
With a ton of mail just
Yeah,
sitting
look
there.
at this.
This agency, VML, hit every fraud indicator in our analysis and billed Medicare roughly $49,000 per patient, about 3.5 times the national average.
They need their curative treatment. They need their they need to be taken care of. They need to know that they can get what they need when they need it, not hit a roadblock because somebody's scammed them.
The number you dialed is not in service. Clark tells us when offices like these close abruptly, it's real patients in desperate need who pay the price. How does that make you feel as somebody who deals with patients who need this?
Sad, really sad, because I talk to them every day. I'm sorry, I can't.
I wonder how they can go for a full year and still not have their license revoked. Is that a systemic failure?
You need to be responsive to the red flags, react to them, not just count them, but do something, take action. Our main lane is the accountability side, the criminal investigations, the civil investigations. That's after the damage is done, though, unfortunately.
The State Attorney General Rob Bonta says his office has brought hospice fraud criminal cases against 109 defendants and about 24 civil cases. What would you say to citizens who are throwing up their hands and saying, how long is this going to persist? Is my government doing anything to protect my taxpayer dollars?
Again, I share it. I have the frustration. So to the citizens that remain frustrated, I understand. I share your frustration. Please know that we have increased our efforts. We're working overtime on prevention and on accountability, and we will continue until hospice fraud in California is rooted out.
CBS News reached out to them almost 60 hospices that have 5 or more flags. Many numbers were disconnected or went straight to voicemail. Representatives and some others denied any fraud and said they were legitimate hospices with real patients. Back in Van Nuys, we tried the hospice right next door to VML. We knocked, then called during the posted business hours.
I apologize for that. Hey, how you doing?
Wow. We couldn't reach anyone, and we'd soon realize these operations may be
So-
connected. Part of what advocates describe as a web of hospice agencies that come and go. But
Hey, how you doing?
Reverend Ray Huang is a longtime
Yes, hi.
Democratic Socialist of America member.
We're over
She
here.
supports the anti-business Green New Deal to increase taxes
Papa
on
Crystals.
corporations to provide free public transportation.
How you doing?
Vote no on DSA's Reverend Ray
I'm
Huang.
over here talking about the Hospic fraud in California.
Just water and the touch of a button.
Oh,
Outdated clean
yeah.
methods have dominated our
How you
routines
doing?
for far too long, compromising on either scrubbing power.
Today, the Department of Justice and
Yeah.
our partners are
Yeah,
announcing
so
a series of fraud charges being unsealed today.
yeah, so what's going on here with the Hospic? Huh? Repeat. Excuse me. Hey, what'd you say? Leave what? Hello? Where am I leaving for? Okay, so basically we see here that these people are trying to clean up LA, but these people are trying to clean up LA, but the Democrats on the other side, they don't want that. They don't play that game. So they want to keep it there because remember, they want to be number 4 in the GDP. They want to be number 4. So that's what's going on here. They want to go up to number 1, and they don't care how they do it because they're just taking the playbook from the same people, corruption after corruption. So let's listen and see what goes on. What's going on here? Hey guys, how you guys doing? I'm over here doing TikTok also.
In the Central District.
Hey,
of
how you guys
California.
doing?
You will hear in a moment about the nature
Hey,
of these
tap the
charges.
screen.
It is important first, however,
Tap the screen. Hey, how's it going? Yeah, we're over here talking about fraud, with the Hospics. I'm from California. We have some guests coming in live from TikTok. Oh, you're from Dubai? Wow, that's nice. So how is it quiet there right now because of the war? Because of the WAR? Huh? Huh? Hello? Hello? Wow. I do not know what's going on there. That's some weird stuff. They're all laying on the bed, making weird faces while I'm talking. I don't know what the hell that is. that did not look right. You guys, stop coming to my channel, man. Stop bugging me. Let me do my stuff. Leave me alone. Man, so many hurdles you gotta jump just to get things going. It's so ridiculous. So, as we see, this guy over here. Okay, let's read it again. It said here that 1.5 billion cut In May of 2025, Newsom proposed a 1.5 billion cut specifically to Medi-Cal. That's basically because Trump has cut the U.S. aid and all the other care, that because basically the doctor could charge whatever he wants. He sends the bill and it's taken care of, you know? So we see what's going on, you know? Wow. And I know the Hospice made millions upon millions during the COVID-19. Okay.
To understand why the work to stamp out fraud matters. This work matters because every single day, the hard-earned tax dollars of Americans are being robbed.
Yes.
The lowest estimate of theft from taxpayers each year is around $230 billion. If you spent $1 million every single day, you would still be spending after 600 years. And $230 billion is the lowest estimate. Some models estimate far higher annual fraud amounts. It also matters because fraudsters who target taxpayer dollars do not just steal from taxpayers. They also prevent critical benefits from reaching those in need and sow seeds of distrust in government institutions and civil society. No more. No more.
No
The
more.
whole of government, including all of the great partners on this stage, is focused on unmasking the criminal actors who are exploiting the American taxpayer. The president's whole of government anti-fraud task force, led by Vice President Vance, is already urgently on the move. The goal is to secure the financial integrity of our country, because the American people deserve a federal government that stewards their money wisely and protects it from wrongdoers. As for the Department of Justice, under Attorney General Bondi's leadership, we are laser focused on investigating and prosecuting every culpable criminal actor in the chain of culpability, all of those responsible for defrauding the United States of America. Our goal is deterrence. Stop the lies, stop the dishonesty, stop the theft. If you don't, we will be coming, because no one should be allowed to rip off the United States of America. With that, let me introduce the first Assistant United States Attorney for the Central District of California, Bill Assaley, to highlight the enforcement actions from today. Thank you. Good morning, everybody.
We're already seeing this. We're gonna play it again.
And your hammock. Be invisible. Get seen, get booked. Booking.com. Power, heat, size, an impossible.
So we see here it says that Gavin Newsom.
Fast charging, no power drop, no overheat.
What the hell's going on here, man?
Breakthrough. Charge at full speed of 3 original.
It says Gavin Newsom spent $1 billion
210
in tax
from paradox to
in taxpayers' money.
medical
You see?
consequences.
And taxpayers' fund to import 400,000 illegal aliens from poor countries to essentially serve as activists for the state's democratic political machine. An elite-dominated economy, according to a report. The April 22nd article in the City Journal by Christopher Rufio titled How Gavin Newsom Subsidized the Migrant Invasion. Wow. It states that the 2 million illegal migrants in California are pawns, merely the instrument of an activist class that would like to see America burn. And isn't that true? Because all of their objective is against securing the border, making America great again. Their making America great again is the American dream, where they take away from California taxpayers and give it to the immigrants who are going to work cheaper for them, who don't know the history, who are going to take contracts, don't know how to read, and then they make more money because they don't know the law. Like when I go to court, they don't have a judge up there. They have a magistrate. They have basically their friend who's going to or an assistant who's going to act as a judge for today and come down and rule on them. So basically, I go up there and I say, they say, who needs a judge? And I'll be the only one that raises my hand because I know the law. They don't know the law. They don't know that only a judge can conduct a traffic court ticket. Not it's just a traffic, but they put criminal on it. So now you need a judge. But these people don't understand that because with a judge you could exercise more rights. Whereas if it's a magistrate, you can't do that. Second of all, they don't know the law. I mean, they know the law, but they're learning. They don't have that experience. They haven't been in the field long enough as an attorney, as a lawyer. So like little things like that, you gotta know. They come to get you. They come to your door. Knock. Open the door. You don't want to open the door. You say you need a warrant. But a lot of immigrants don't know that. They'll open the door, come on in. That's what my mom would do, you see. So we see that they want people who don't know the system, dumbed down, want to work for cheap labor. You don't need a license. It's okay. Just go get a truck and start driving, you know. So the state's Democrat government also steered 110 million in taxpayers' fund to the major Latino political machine. Wow, this is crazy. This is crazy. Let's watch what's going on here.
I was terrified.
It's the taxpayer-funded system that's supposed to get you through your final days.
I didn't feel protected. I didn't feel safe.
Hospice care to help those who are dying and their families.
They said you're in hospice. And I said, what? What are you talking about? Do I look like I'm in hospice? She goes, no.
Ken with CBS News. Do you mind opening the door? A CBS News investigation found it is ripe for fraud, especially in California.
Yeah, you can't throw a rock without hitting a hospice.
Wow.
Hundreds of red flag providers vanishing overnight.
Well, there's no hospice there.
Companies accused of overbilling. How does that make you feel? Real patients being denied care.
Really sad. Because I talk to them every day. I'm sorry.
Costing hundreds of millions of taxpayer dollars.
You can't explain that. There's no explaining that.
What's being done about it? Is my government doing anything to protect my taxpayer dollars?
I share it. I have the frustration.
And why it's costing so much more than money?
It makes me lose faith in the system that is built to protect us.
Yeah, it's so sad. It's so sad that this is happening to people who are paying their taxes, looking for early retirement.
Oh, boy.
Now,
That was great. Let's do it again.
Lynn, you are old and in hospice, so
now we know that this is the white gated community. We know that they get everything, benefits and privilege. But a lot of them, when they retire, if they're rich, multi-billionaires, we're talking about 20 million to 40 million. Now, if they're middle class, we're talking about 500,000 to, maybe 10 million. You know what I mean? Now, is that going to make them last long? Yeah. But in the back of your head, you're like, remember that their lifestyle is high. It's up there. The mortgage is still maybe haven't been paid off. Maybe they're still having to make a payment of $6,000 a month. You see, the property tax, that's 8 to 10 million. No, 8 to 10,000. I'm sorry, 8 to 10,000. The landscape, you see, when these people get old, that landscape starts to look a little bit dirty and messy and not maintenance, because most of their money is going to medication where the doctor's just ripping them off. $500 for a Tylenol. Where does that happen? In LA, Beverly Hills. So we see here the electricity to keep all the. You will go into elderly people home, and one side of the house will be all dark. It'll be shut off. I mean, a hoarder could go stay in there. You know what I mean? And then the other place is all light. So you see the difference. You see changes occurring, and from there you start to see that 10 million is not a lot of money, you know, because 1 million is what she spent in a year, or half a million. Let's say if she could do it right, you know, maybe uh, maybe maybe she spent in close to, I say, with that budget of, remember, she's gonna blow right through. It's $8,000 a month for the mortgage, so it might be lower, maybe $5,000. So you calculate that. A rough estimate is that maybe she's spending $120,000 a year. Okay, and so basically 1 million is 10 million is still good for her, and she could hold that till she could ride that till she passes away, and then give the 4 million to her grandkids, spread it apart. You look at that kind of stuff. Now they say don't put the house in your name, put it in a trust, so your kids don't end up owing taxes. And it's sad that California does that with the property tax. So you see that when they go to a hospice to take care, there's a lot of fraud going on, even to the point where they're stealing her information and might be taking her property and selling their deeds. It's taking their deeds, taking their house deed, to the fact that when they want to sell their property, they can't because they got a lien on it, or somebody stole their deed, which happens to a lot of black families. So the fraud in California runs deep, really, really deep, man.
I would be a little bit more proud about my accomplishments, but 69-year-old Dr. Lynn Ianni just ran me up and down the pickleball court. 2 years ago, she was, according to Medicare records, dying in hospice care.
Dying. They knew she had money.
As physical therapy, simply because I had a kind of an injury on the pickleball court. The administrator at the office was like, "They're not going to pay any of your claims," and I was shocked. They said you're in hospice, and I said, "What?
What?
What are you talking about?"
That's like me.
No, I know you.
They canceled your license. What? Why?
Which she obviously.
We don't know why. You have to call them.
That meant Ianni had no coverage and no easy way of getting unenrolled from hospice. Obviously, this was a major hassle. Lots of phone calls, lots of paperwork. What were the medical consequences?
I was terrified. I mean, something can happen. That's why you have health insurance of any kind. And just to think you're literally without coverage because of some ridiculous, fraudulent thing.
My name is Adam Yamaguchi. I'm with CBS News.
He's
A CBS
Japanese.
News investigation found an industry ripe
She's
for
real
fraud,
quick.
especially in California. Companies accused of overbilling, real patients denied care, and it's costing hundreds of millions of taxpayer dollars. The hospice Ianni was fraudulently enrolled in is called Fortuna. When we called, no one answered.
The mailbox is full. I cannot accept any messages at this time.
The state of California increased monitoring of the hospice industry 4 years ago, identifying the hallmarks of fraud. Fortuna has 2 of them, and it's hardly alone. CBS News analyzed every hospice licensed in LA County, more than 1,700, and checked for the same warning signs the state used, like multiple hospices packed into one building, or caregivers whose patients, supposedly at death's door, are discharged alive. 3 years after the state crackdown, which included a moratorium on new hospice licenses, our investigation found more than 40% of agencies still show at least 3 of these state-defined indicators of potential fraud. So Victory Boulevard seems to be a hotbed of...
Yeah, you can't throw a rock without hitting a hospice.
Sheila Clark, a hospice patient advocate, took us to what she described as the ground zero for hospice fraud, a 3-mile stretch of Los Angeles that's home to nearly 500 hospice company offices. There's one hospice here that hits all 6 of California's red flags of possible fraud.
Well, there's no hospice there.
Legal office.
Yeah.
With a ton of mail just sitting
Look
there.
at this.
This agency, BML, hit every fraud indicator in our analysis and billed Medicare roughly $49,000 per patient, about 3.5 times the national average.
They need their curative treatment. They need their they need to be taken care of. They need to know that they can get what they need when they need it, not hit a roadblock because somebody's scammed them.
The number you found is not in service.
Now, there are approximately 1,800 licensed hospice agencies in Los Angeles County. However, due to widespread Medicare and Medi-Cal fraud, state and federal task force have suspended hundreds of these providers. And a lot of them are on, they're looking for them, they're searching for them, they're working from home. They even have a lady who they arrested 3 times. They arrested her 3 times for hospice. Well, she got, what she did was that she put it in her kid's name. She'll get caught, then she'll put it in another kid's name. She'll get caught, and then she'll put it in another kid's name. So, and then she went to prison. And while in prison, she opened a hospice in another person's name. So wow, even in the prison, I don't know how she did it in the prison, but she must have got somebody to do it for her. But they maybe asked the person, "How did you know it?" "Oh, so and so told me." So this is a lot, and a lot of these people are doctors, chiropractors, Romanians, Armenians, Persians, Ashkenazis over here in California, and Asians. So that's the ruling class here in California, and basically, California right now, due to the issue going on, has revoked and suspended 447 applications, and also suspected fraudulent claims totaling more than 600 million by the agency task force. So basically, out of that 447, Los Angeles area hospice were suspected of fraudulent claims totaling more than 600 million. So be careful. I mean, if you have a hospice right now and you might have done a little bit of fraud, I think it's good to maybe get an attorney, write a letter, let the IRS know before they figure it out, or close down, or, best thing to do is to get an attorney and figure out what you could say, how you could reduce your time. Maybe you could just do probation, or you just don't open up any agencies anymore. It's going to be tough. So we see right there, we got to move on.
Clark tells us when offices like these close abruptly, it's real patients in desperate need who pay the price. How does that make you feel as somebody who deals with patients who need this?
Sad, really sad, because I talk to them every day. I'm sorry, I can't.
I wonder how they can go for a full year and still not have their license revoked. Is that a systemic failure?
We need to be responsive to the red flags and react to them, not just count them, but do something, take action. Our main lane is the accountability side, the criminal investigations, the civil investigations. That's after the damage is done, though, unfortunately.
State Attorney General Rob Bonta says his office has brought hospice fraud criminal cases against 109 defendants at about 24 civil cases. What would you say to citizens who are throwing up their hands and saying, how long is this going to persist? Is my government doing anything to protect my taxpayer dollars?
Again, I share it. I have the frustration. So to the citizens that remain frustrated, I understand. I share your frustration. Please know that we have increased our efforts.
It's not frustration. It's hate.
California,
You know, when you see these people driving a G-Wagon, Mercedes Benz, and you had to go from a Lexus to a Honda to a Toyota, and they're still pushing the husband's pushing a G-Wagon, and the wife is pushing a Land Rover, and they're looking at you like, and they don't even speak your language. Fraud.
Wow. We couldn't reach anyone, and we'd soon realize these operations may be connected.
That's all you're gonna see in the office right there. Vintage.
Hospice agencies that come and go, but continue submitting a steady stream of bills to taxpayers, whether the patients are dying or, like Ayani, are still out playing pickleball.
Lock them up. Yeah, so it's crazy out here. We got to be really careful. Woo!
The state of California says that if a doctor is involved with any more than even just a few hospices, it is a sign of potential fraud.
Wow.
A CBS News investigation into hospices found an industry ripe for fraud, especially in California, where agencies were paid millions in taxpayer dollars for services never rendered, care that's supposed to help people through the end of their lives. At the heart of the industry are doctors who are trusted to sign off on care. But in records for the active physicians caring for terminal patients, one stands out. A man whose name appeared on claims from 126 hospices and had 60% more in Medicare reimbursements than the next closest doctor in 2024, the last full year of available data. Yeah, my name is Adam Yamaguchi. I'm a correspondent with CBS News, and we're doing a story about hospice. Dr. Rajiv Buva. We're just trying to understand how often he's here. We wanted to find Dr. Buva to ask how he managed to work for so many different providers. So we followed a trail of hospice offices linked to him in Medicare.
That's Los Angeles. You see that?
My only comment is not every hospice is like that. There's people who really need the help, and we do provide the help.
Our information tells us that he billed Medicare upwards of $5 million as of the end of September of 2025.
So there's some sort of disconnect between what the records show and what they are telling us.
That disconnect only grew as we followed the federal data trail, which links Buva's name to $71 million in federal Medicare.
So fixed. You know that was a script.
To another hospice.
That's been nice.
Was on bills for 66 patients in 1 month.
That's been nice right there.
That's impossible. We couldn't possibly have that many patients at any given time. And he also told us that Dr. Buva no longer works there. On average in California, a hospice doctor cares for about 140 patients a year.
His mistress is managing it.
For nearly 2,800 terminally ill patients. Fewer than 2% of them died, even though most people seek hospice because they are dying. State auditors call that kind of low death rate a sign of possible fraud.
There's no reason to think that that's legitimate.
Dr. Christina Newport has been in the hospice field for 18 years. There are a range of reasons why one physician might be identified in connection with the care of so many patients. One possibility, the doctor's identity was stolen and used to fraudulently bill the government.
Wow, you see,
for a doctor to work at dozens of hospices at any given time.
If someone is really effectively evaluating the plan of care for every patient that they admit to the hospice, which is their job and their responsibility,
112.
They, would have a superhuman schedule to do that in a meaningful way.
We don't know exactly why Dr. Buva's name came up so much. The data trail led us to another hospice nearby. We understand that Dr. Rajiv Buva is the medical director here. We're just trying to get some information about it. He's not? No. Was he at some point? Yes, he was. But you're telling me he no longer is associated with you guys? Was he at some point? CBS News found
Wow.
Buva's name tied to several hospices that lost their Medicare certification for what regulators called an abusive billing, a pattern of submitting improper claims. We reached out to him on the phone and email, but couldn't connect with him. With no sign of him at these offices, we headed to Dr. Buva's home address. I am parked right outside his house. Hopefully he will answer the door and answer some of my questions, and if not, I came prepared with a letter here. Dr. Buva came out, surprisingly spoke to me for about 20 or so minutes. He knew exactly who I was. He was very familiar with our reporting and immediately said, I don't know what else I can tell you. He said that being affiliated with dozens of hospices is not illegal, right? And I said, you're correct. There's nothing in the law that prevents someone from being affiliated with many. But again, it raises flags, and that's what I have questions about. Buva said he wanted to see our information. Until then, he wouldn't talk any further. I'm back at Dr. Buva's house, right here. We returned with our data.
Why are you bugging him?
Hi, Dr. Buva. This is Adam Yamaguchi again with CBS News. We were able to hear you through the door.
Get
Just want to
out.
give you every opportunity to speak with us before we publish. I've got a list here. Give him every opportunity. Rang 3 times, knocked once. Talked through the wall, or the door rather. Came with what he asked for. He's made his decision not to talk.
Republicans.
And that's it. It's gonna get worse. Don't, man. When you go to other, now he's a doctor now. When you start going to the mafia, the mobsters, and these young kids, young adults, it's gonna get a little bit. He can't just pull up to people's house like that when he starts going after the really bad ones. But that's all for today. Thanks for coming by. Subscribe, like, and share, and come back for more. Thanks.